ओटावा च सेहत मंत्री जीन यवेस डुकलोस ने फैडरल सरकार के नवे पेश किए कानून C-17 बारे चर्चा की जो कोविड महामारी द्वारा देरी नाल सर्जरियां दे बैकलॉग नूं घटाउण च मदद करन लई सेहत संभाल फंडिंग च $2 बिलियन वाधू देण दा वादा करदा है। जीन यवेस दे नाल मानसिक सेहत मंत्री कैरोलिन बोनेट भी मौजूद रहे।
We are pleased to announce an investment of $2 billion to help our provincial and territorial partners significantly reduce the backlog of surgeries delayed because of COVID-19. This major investment could help provinces and territories clearing hundreds of thousands of backlog surgeries, such as cancer and heart surgeries or hip replacements. These amounts will be transferred to our provincial and territorial partners through a one-time top-up of the Canada Health Transfer. This is a significant first step on the road to addressing the major healthcare challenges ahead of us. In addition to the $4 billion for backlogs announced in March 2021, today's announcement will help repair the damage caused to our healthcare system by the pandemic. It is also setting us on the longer-term path towards ensuring that our healthcare system can meet the structural and demographic challenges of the 21st century. In order to do this, we will want to work collaboratively with our provincial and territorial partners and focus on the needs of patients and the achievements of concrete outcomes. Although it is not over yet, we already can and must learn from the pandemic. We sometimes forget it or may take it for granted, but several decades ago in Canada, we made the choice to have a public and universal healthcare system. Collectively, as a country, we've made the choice to leave no one behind and to deny no one necessary care, regardless of status or ability to pay. At a national level, not without a good deal of inspiration from the health insurance that the late Tommy Douglas helped put in place in Saskatchewan, we first made this choice under the leadership of the government of Louis Saint-Laurent. Our announcement is twofold. First, we have news to share with regards to surgical backlogs, and second, we will briefly lay out our vision for the future of federal and provincial collaboration on healthcare in Canada. In many cases, the pandemic has brought to light problems that have already existed for many years and made things even more difficult. This is particularly true in the case of delays for surgeries, diagnostics, and treatments of all kinds. This problem was not and is not new, but the pandemic has contributed to exacerbating it even more acutely. These delays are a burden that can be very hard to bear for the affected patients, their families and their loved ones, as well as for the healthcare workers caring for them. Imagine for a moment that you were diagnosed with cancer, recommended surgery, and that, when the time comes, you're informed that your surgery must be postponed. The reality is that for lack of time, lack of staff, and lack of space available to operate, too many of our fellow citizens have suffered and are still suffering this ordeal.